Good morning, Brad.
Good morning.
Welcome to Embrace Eternal Beauty Aesthetics and Wellness.
Thank you. Thank you.
How are you today?
I'm great. It's going to be a good day.
Yes. And thank you for giving us the opportunity to feature you in our first feature of the month. Actually, we're going to post this in June. And, we want you to share your story to all our current patients and also for our future patients about your journey. We started with aesthetics and then with wellness.
Absolutely.
Okay. So, Brad, tell me more about yourself.
Okay, my name is Brad. I am a funeral director, and I also focus on funeral service education.
Wow.
So I spend my time teaching. I also create social media content about funeral service. And ultimate goal is to help students pursue their dream, becoming funeral directors.
Oh, that's awesome, Brad. And I think as you know, I'm also a educator like you,
Right.
and we are here to not only to educate the younger generation or the population in general, but we are here to inspire many people. Perfect. And so, what brought you here in Embrace Eternal Beauty Aesthetics and Wellness in the first place?
So it started out simply the way I looked. Right? I was scrolling through social media, and I was looking at the videos of myself. And I thought, that doesn't reflect who I am on the inside. I saw this person that looked old to me. I mean, I am older, but you know what I'm saying?
Yes.
Like, that doesn't represent who I am. So I decided, let's do something about this. Let's make a change.
Okay. So I remember that when you came here, right, you want to do some, to improve yourself, your physical appearance, right? But after with some discussions and I felt like, we can also help you from the inside.
Right.
Because beauty is actually subjective, right? But the most important is on how we feel from the inside because it translates to the outside. And it's very important that we take good care of ourselves from the inside. And, if you're happy, if you're healthy, it can really, translate what you see outside, right? Is that correct?
Absolutely, absolutely. I think that I spent a lot of time helping other people,
Right.
Teaching, helping students, and in a way I put on the back burner helping myself.
Right.
You think I always need to do things for others, and I thought, what, I need to do something for me. And it wasn't just aesthetics. It turned into, this was a health issue. I had sleep apnea, high blood pressure, joint issues, fatigue, and it was exhausting.
Right.
And so I decided, let's make the step in the right direction and let's do something about it.
Okay, perfect. Brad, is that okay if I tell them what you came here in the first place? So actually, Brad came here 3 months ago, and he came here for the first time. At that time, he has some concerns about his face. So as part of my aesthetic and medical spa clinic, so what I did for all patients who have any concerns about the skin, about their health, I always do an initial consultation. So when we did that, so I gave him some recommendations about his face. We did some procedure. Just to improve the quality of his face. And at the same time, he mentioned to me about sleep apnea. So actually, for everyone's knowledge, many patients, 30 to 40% of patients with diagnosed with atrial fibrillation is an abnormal rhythm in your heart that later on can cause patients to have one of them is stroke complications. 30 to 40% of them has an undiagnosed sleep apnea. So when I mentioned it to Brad at the time, it's not my intention to scare him. But as an internal medicine physician and a hospitalist in the hospital here in town, I've seen a lot of cases, people who has the same situation as you. So as a doctor, it's my responsibility to educate everyone. And so we prevent complications later on, right? Or hospitalization. So when I mentioned it to Brad about our weight loss program, and what's your first, what is your first thing that you think about that program that I told you earlier?
First thought is, oh no. I don't want to be one of those persons, you know what I'm saying, right? That loses all this weight, their face looks sunken, and then they gain all the weight back.
Perfect.
And that's one of the reasons I came here to Embrace is because you are a medical doctor.
Right.
And I've seen a lot of other salons or clinics, rather,
Yes.
that focus simply on aesthetics
Right.
and not as much on the total wellness of someone. And that's what I really found comfortable with you, and that we've looked at other things, besides just my face. We've talked about, okay, how can we improve your overall health? And this is the way we've done it, and it's gone well so far.
Thank you. So you're right, Brad. So as an educator, I also teach medical residents and residencies to the internal medicine residents in the hospital. So for me, it's my passion since I was young to share my knowledge to other people. So this knowledge that I have is accumulated over time. As I already told you also that I'm also a research director in the hospital. I do QI projects. I also publish, I'm a peer reviewer as well for different journals, particularly in terms of obesity, cancer research, and many things. So for me to prevent, it's very important, the prevention, before you have these complications like heart failure, or if you can have, for example, in the liver, fatty liver disease later on that can lead to cirrhosis, right? So for me, it's very important for me we can catch it early. So there are many things, chronic diseases right now, like diabetes, right? Or stroke, or heart failure, or cardiomyopathies. Actually, we can prevent them. We can delay the course of these problems. For example, diabetes, right? So diabetes there are two types of diabetes, for example. You have the type 1, so you have an autoimmune problem. You have your pancreas. There's an autoimmune, there's an antibody against your pancreas that produces insulin. And the other most common is also the type 2 diabetes, where you have insulin resistance. Mm-hmm. Actually, I've been telling all my patients, also you, I know you don't have diabetes, but in general, always educate them. Many people, they don't decompensate because of diabetes per se. It's the complication of the disease. And how can we prevent those? It's by prevention, by proper education. So Brad, what are your initial expectations about your weight loss program?
I did not have high expectations.
Okay.
Because I just thought, this probably won't work. It's a fad, something like that. But what I realized is the medication was more of a tool.
Right.
And people need to understand that it's not a shortcut, that it's not an easy way to do things. You still have to monitor your diet. You have to exercise and make lifetime decisions rather than just rely on a medication. And that's really made the big difference.
That's correct. So for our future patients, so when Brad came here, so after he decided that he wanted to decide to lose weight, so what we did, we have a comprehensive consultation with him.
Mm-hmm.
We did a comprehensive blood test. We check your liver function panels. We have your hormone, like your thyroid, your testosterone. We check your pancreas, your CBC, your red blood cells, your platelet, and stuff like that. So it's a comprehensive test. And then once we have the results, what we did is if he's a candidate for the weight loss program, so we started it, mm-hmm. and also he was able to talk and speak to our nutritionist, who also has a big importance in our program, mm-hmm. right? And is there anything else that you can add?
The nutritionist was an extra benefit.
Yes.
Because we went through what was my current diet like, right. What was my current exercise level, and then we focused on small changes.
Right.
Because you can't overnight change everything about your life. You can't start exercising, change every meal, because that's almost recipe for disaster, failure.
Right.
So you focus on, we learned about small changes to make, and then over time we can increase those. So that was very beneficial to offer that.
Very good. And actually, Brad is very compliant and he's very diligent on his regimen.
I'm trying.
Yes. So in most patients, they always tell me like, Doc, I don't feel hungry. So the GLPs, right? So they make you feel satiety or you don't feel hunger, right? Because it's the effect, feedback mechanism to the brain. But I always educate my patient, don't just depend on this medication because it's just a tool. By the end of the day, it's you, So exactly. We try to change their habit, with patients. We try to tell them, educate them about the importance of exercise. Mm-hmm. So I know right now there's a lot of, controversies and hype about peptides, right? But these peptides, they are the exogenous peptides. They are produced outside your body. And actually, they are all patterned inside your body. like for example, let's say maltitide or tersatitide, right? So these are your endogenous peptide actually that is being produced by your small intestines. And what it does, it increases the, secretion of insulin when you eat too much, and it will tell your brain not to eat too much, just like the hunger stuff. So it's a very good tool for weight loss. Right. What changes have you noticed in your confidence? Did you notice anything?
Absolutely. The way I feel about myself on the inside is starting to reflect on the outside. And when I look at the mirror, I say, I made these changes. I feel great, and it's great. And it's not just the way I look. It's the way the decision that I made to make a difference. The decision I made to focus on my health. I think that has brought me the most confidence. It's knowing that I'm in control, and these decisions I can make along with you to start this journey, and it's been great so far.
I'm so happy for that, Brad.
Yeah.
I mean, Brad has been a very good patient of ours. Okay, Brad, so what activities can you do now that were harder before?
Before, it was not having the energy to, I don't want to say move, but become physically active, because I didn't feel like doing anything.
Right.
And it becomes this perpetual cycle. I don't feel like exercising, so I don't. But exercise is what I need. Yes. Having the ability to do the things I want comes from doing that. So it's a cycle. If I don't exercise, I'm not going to feel better, but I don't, go back and forth with that. So now I've definitely seen an improvement in my attitude towards becoming more active. I am more active, and just the feeling of having more energy, less fatigue,
yes.
And my joints aren't aching all the time. I'm not hobbling around. I actually feel like moving and enjoying my life. So.
Good. I'm so happy to hear that. Okay. So, because when you have extra weight, right, extra adipose tissue, you're carrying a lot of weight against the gravity. So your joints will be the most affected with that. So number one, we're not getting younger, right? So the impact on our joints, like the ankle, the knees, and the hips, are the most affected because of we're standing against the pull of gravity. And I'm so happy that you see some improvement with that. And also because obesity, right, is also lead to inflammation. So inflammation in all parts of your body, particularly your joints, also the gut. Now there are a lot of new studies about the leaky gut syndrome. So it's not only gonna affect what's inside your gut, but also your other parts of your body, like your skin. So that's why when you do skin consultation with me, I also target your gut health. So it's part of your consultation with Dr. Pabona.
Absolutely.
Very good. Okay, so how do you feel when you look in the mirror today?
I feel confident.
Okay.
I feel that that's the person I want to be. And why didn't I make this decision years ago rather than just a few months? But I look at that as I did make that decision. And I truly now feel like, hey, that's me, that's how I feel on the inside, and it's great to see that person back and know that I've taken control of my health. And I think that's the most important.
So Brad, if you could talk or speak to yourself 3 months ago, what would you like to tell him?
Why haven't you already done this? Yeah, I would say this is a good journey. This is a good journey, and go for it. Yes. You should.
Actually, it's a beautiful journey, So that's why it's very important, to embrace yourself, right? So embrace yourself, love yourself, take time for yourself. Your number one investment is yourself, right? Your other material things like, your car, your house, your money, it's just secondary, right? But your number one investment is yourself.
Oh, I agree.
So Brad, so what would you say or advise to someone who is struggling with weight loss?
Realize you're not alone.
Yeah.
And many people struggle with weight loss.
Right.
But you do have control. You do have the ability to make decisions to improve your lifestyle.
Right.
And it's not going to happen overnight.
Yes.
There's no magic pill, there's no magic drug that you're going to lose weight forever and you never have to change any lifestyle.
Right.
You know, but you can do it. And there are tools that you can use, medications, to help you achieve that goal. And at the same, because that will help you start seeing results, which further motivates you to continue to eat healthy, continue to exercise. And that's the best part about it is you're in control of your body. You can make those decisions, and you'll be very thankful you did, for sure.
Well said, Brad. So, Brad, what you gonna say to someone who are considering to start with GLP-1 treatments?
Okay. First, if you're going to consider, go with a medical doctor, for sure, because you need someone to oversee your overall health. That's why we did blood work. We talked about medical history and really understood this is the journey you're going to be on.
So when Brad started here, so all the blood work that we do, you know, after we have the result, either it's normal result or abnormal result, I just explain it to him. So all the physiology on his body, either it's the liver, your adipose tissue, or your gut health, or about your sleep apnea, when you come to see Dr. Pabona, I will discuss with you anything as much as I can to educate you and, you know, to give you some insights about your health.
And I really appreciate that.
Yes.
Because a lot of times you have lab work done.
Right.
You get a call from medical practitioner from the office. A lot of times maybe a nurse.
Yes.
Once you let you know your blood work's great. I'm serious. And that's what happens. And no one sits down and says, it's great because of this.
Yes.
And this is what this number means. And we went line by line. And that was important because not many medical doctors take time to listen to patients and actually explain the process, why we're doing this, and what the benefits and advantages, disadvantages, side effects, although it's very important to talk about.
Actually, with Brad, he's not alone. Actually, for many patients that I see here in the clinic, actually, 99.9% of them, almost all of them, telling me that, you know, their nurse practitioners or their medical providers just give them a call and say, oh, your blood work are normal. So everyone are just clueless, you know, why this blood work was done. Why is it normal? Why is it abnormal? So when you see Dr. Pabona, I will explain to you everything. Why we are getting this blood test. Because some of these blood tests are not really necessary, it's wasting your money. So why we're getting this blood test at Dr. Pabona's Medical Spine Clinic. Okay. So what are your goals now? We're looking forward to your journey for, you know, for this weight loss.
Absolutely. Continue the progress that I started and maintaining this lifestyle of taking care of myself, making the changes to my diet, my exercise. And again, you're going to have slip-ups. You're going to have the hamburger, you're going to have the pizza. And I've learned that that's okay. You know, don't beat yourself up. Say, oh, I ate this big meal. Okay, just don't do that tomorrow. And so it's continuing the progress, and that's a journey I look forward to.
So Brad, so one more thing, so they will be, you know, they know, like how much weight did you lose for the past 3 months?
In 3 months, I've lost 25 pounds.
Wow, it's 25 pounds, right? So it's like almost 1 pound or 1 pound per week or 2 pounds per week.
And I think that's good because you don't want to lose 5 pounds a week because that's not sustainable. You know, 1 or 2 pounds a week, that's reasonable. And you're seeing results, but it's not drastic. And I think as far as long-term weight loss, that's what you want to achieve.
Right. And because, you know, there are many, you know, patients that I also met, you know, they have this what we call when they stop it, they have a rebound. So the problem with that, because you are not, you know, many of them are not well educated, and, you know, I mean, our body, you know, what changes in our body, it happens not just overnight. It happened through time, you know. So I always tell my patients, even on the skin, you know, if you want changes in your skin, it's like an investment, right? It's like you put your money in the stock market. When you put your money there, you just don't look at it every day. You look at it in long term. So you put it there and forget it. So the same in your routine, right? So continue your routine, and for the skincare, just continue doing it. And the same thing with your, with your weight loss, continue what you're doing. Check your diet, exercise, and stuff like that. Okay, so what motivates you to continue?
Seeing the progress I've made so far and realizing how I feel on the inside is great. Not just how I look, but the way I feel.
Yes.
And as far as health-wise, the energy, it's exciting. I appreciate it. That's a great journey.
Thank you, Brad. So is there anything else that you want to tell to our audience?
I would say explore your different options and make the decision with Dr. here, Dr. Pabona, about what would work best for you.
Yes.
Because this medication may work for you, or this skin treatment may work for you, and someone else it wouldn't.
Right.
So it's important to discuss those items and to have someone you feel comfortable with.
Right.
And having that, it feels like you're talking to a friend.
Yes.
We're just having a conversation, and it's not intimidating, and it's been a great journey.
Oh, good. So really, Brad, I really appreciate you this morning, and to all our current patients and future patients. So, Embrace Eternal Beauty Aesthetics and Wellness is located here in Hot Springs. We are located on 4328 Central Avenue, Suite B, Hot Springs, Arkansas, 71913. If you want to book for any appointments, if you have any questions, I would suggest you can text us or call us at 501-282-8628, or you can book for initial consultation either for the skin or if you want for weight loss program. And also we offer hormone optimization and hormone replacement program for both men and women. So I also offer bioidentical hormones like the estradiol and progesterone and testosterone for women, and also testosterone for men. So if you guys have any questions, don't hesitate to ask me, and I'll do my best to address your concerns. And as what Brad said, don't be afraid or don't be scared. We're not here to judge you. I'm here to help you and educate you. So if you want to invest in your health, start now, because the interest is exponential, and you will see it later on in your life.
Agreed.
Okay, good. Thank you, everyone. Thank you for watching us.
Thank you.
Thank you, Brad.
Thanks for having me.
Appreciate it.